Hello everyone, my name is Kenya. We're here at the Elite office in Houston with our patient Tanea. We're gonna ask her a few questions on how she's doing, and she's getting her arms done. Okay, hey Tanea,
Hey.
what areas are you targeting today?
So, targeting my arms today.
Okay, and what made you choose AirSculpt?
Well, I actually had a procedure here about a year ago, and it was so easy. So I just wanted to come back and do my arms.
Awesome, and how are you feeling so far?
Amazing.
Great,
No
great.
pain.
Awesome, do you feel any pain? What's it feel like?
No pain, just some vibration and some maybe like pulling. But other than that, nothing.
Awesome, and how do you feel about being awake?
Good. I got to eat breakfast this morning, so that was the most important part.
Great.
But it's much safer this way, so I feel great.
I know you can't hear it now, but what music are you listening to?
I think it was just like a pop mix or country mix and a little bit of both. So.
And what's it like seeing all the fat get removed right before your eyes?
It's awesome. It's awesome because you have all these hard, stubborn areas that no matter how much you forget, they don't go away. So for me, it's awesome.
Great. Would you recommend this to your friends, family?
Yeah. In fact, I've already had a bunch of friends come in here and do procedures, and then they've come back for more. You know, it's so easy.
Okay. So doctor, how is your patient doing?
He's doing awesome. It's a great way to do a procedure. AirSculpt lets me really shape this arm up. You can see how much, even with the numbing fluid in there, how much skinnier it's getting, and we're actually adding shape to the arm as well, bringing out the shoulder and really slimming out the whole back of the arm. So she's going to get a very nice result when we're finished.
Okay. How much fat have you taken out so far?
Right now we've taken about 200 cc's.
Great. And why do you like doing AirSculpt?
It's just a very efficient way of sculpting an area, especially these stubborn, hard to work on areas that don't respond to diet and exercise.
Great. Okay. And we have a few questions common questions that a lot of our fans ask. With summer being here, when can our patient go in the sun, pool, beach?
Usually swimming, we like any of the access points to be healed up. Have them avoid any salt water or lake or any water like that, probably for a couple months, just because there's more chance to get an infection because of what's in that type of water. But going in a pool, it's okay after everything's healed up, usually within a couple weeks. These areas are going to be a little bit swollen and after the procedure, so I try to keep them out of the sun until that settles down. But they can return to exercise usually within a couple weeks as well.
Okay, great. What is recovery like?
That's going to vary from person to person, but most people getting procedures like this can return to work within a couple days. And like I said, start working out in a couple weeks. They'll usually wear some type of compression garment for a couple weeks, and then after that see if they need anything like that to wear longer.
And how quickly can our patient expect to see results?
It's interesting because she'll see a difference in her arm as soon as we're done, and as the swelling goes down, everything heals up. It'll just keep improving with time. So things just kind of shrink wrap and get better with time.
Great. If the patient were to want to travel, how soon can they fly?
You know, most patients are gonna, if they need to fly or travel, I've had patients come in and within a day or two go back home on a flight with no problem. I just encourage them to keep well hydrated and get up and move about when they're in a flight, you know, just to get their circulation going.
Awesome. Is there a BMI or weight limit in doing this procedure?
It's going to vary from patient to patient. It just depends what their expectations are and the quality of their tissues.
Okay. How many sessions does this take?
This is a one and done type procedure for the most part.
And how much fat can AirSculpt remove?
Typically we take up to a maximum of about 5 liters. Not everyone will get that amount out, but it's really looking at getting a maximal improvement in whatever stubborn area we're treating.
Oh, awesome. Well, thank you so much for taking the time. Thank you, Tanea. Thank you, Dr. Pazarski.
Well, thanks for being with us today.
Thank you for joining us. Y'all have a great day. Hopefully, we'll see y'all here soon at the Houston office. Hey guys, so we're back. We're out of surgery now, and we're just gonna answer some questions from fans as they come in. Okay, so what areas can be treated with AirSculpt? So if we like to say, if you can pinch it, we can take it. We can target anything from your chin down to your ankles. We can also do fat transfers to your breasts, buttocks, hands. Like I said, if you can pinch it, we can definitely take it. Let's see if there's any other questions coming in. Do I need any stretchings for this procedure? So no stretching is necessary, but we do recommend that you walk at least 30 to 45 minutes per day. This will definitely help with the recovery process, and it will help the blood circulation. So like I mentioned, no stretching necessary, but we do encourage you to do light walking the day right after your procedure. Will I be able to lift my arms? You will actually be able to lift your arms immediately right after the procedure. We ask that you refrain from any strenuous activities such as weightlifting, working out. Once again, like I mentioned earlier, you can walk, get the blood circulating, but definitely avoid any strenuous activities for 2 weeks. Okay. Will this help tighten my skin? AirSculpt will definitely leave your skin tighter than it was before, but this is not a skin tightening procedure. If there is loose skin present, it is something that we can address in your consultation. But like I said, we do provide minimal skin tightening. It's just not a guarantee. Can I also target my armpits? Yes, we can actually target the armpits. We can do a full 360 arm procedure that'll include your arms, armpit, front bra rolls, whichever area is necessary to get you to the goal that you would like. How quickly will I see results? Patients often express seeing their results as soon as while they're on the procedure table. You will see results immediately. Between swelling and recovery, it might take some additional time for other patients, but most patients do see results immediately. Does this affect the muscle at all? No, AirSculpt does not affect the muscles, but can enhance by removing the subcutaneous layer of fat. So once we clean out your arms or a different area, then muscle definition might be more prominent than it was before. Is this a permanent procedure? Yes, AirSculpt permanently removes the fat from the area that we are doing the treatment on, so no worries there, as the fat cannot come back. Can men also get their arms done? Yes, men are always welcome as well. They can target the fat in their arms or any other area that they would like the treatment for the AirSculpt procedure. Can AirSculpt fix my arms after getting traditional liposuction done? Yes, this is actually very common. The AirSculpt procedure can address any issues that you previously might have had, and it can correct those issues. It's definitely something that we can address when you come in for a consultation with your surgeon. We can make those fixes even on the arms. Okay, I guess that is all for the questions for now. Thanks again for joining us, and we hope to see you soon.